Hello. Okay, so today I'm going to bring you to the obsessive compulsive and related disorder restaurants. Okay, so now let's imagine if you are in the restaurants, what will you want to order, what will you want to take away from the restaurants? Today, I'm going to bring you to understand better what is OCDs and related disorders, their symptoms, their types, their causes, as well as the treatments for the OCDs and related disorders. Okay, before we go into depth about what is OCD and related disorders, let's enjoy this amazing video before.
Yang, first one's yours. Great. Take number 2.
Go.
Jesse Fannin, 32, unrestrained driver in a rear-end collision.
There was spider webbing in the front windshield where his head hit. BP's 120 palp, pulse 75.
What do you want to do, Yang? Primary and secondary survey, head CT and X-ray.
Hey, Paige, a shepherd when you get there.
Wait! I'm counting the siren whoops. We can't go till it reaches 33.
He also seems to have a touch of OCD.
I was counting the clicks. The turn signal clicks. I couldn't move till it hit 333. The light was green, but I couldn't move. I can't blame them for hitting me.
How long have you been feeling these compulsions?
A little bit all my life, but it's been out of control the last 3 years.
Onset at 30 is typical.
Ruined a marriage. Can't hold a job.
Mr. Fannin.
Is it clean? I need to know if it's clean.
Any relatives with OCD?
Well, my mother killed herself at 38. Ruined her life, now it's ruining mine. Clean, clean, clean?
We clean it between each patient.
I think he needs you to say clean, clean, clean.
It's clean, clean, clean.
Thank you. I know it's annoying. I can't help it. Oh, find a penny, pick it up. All day long, you'll have good luck. Find a penny, pick it up. All day long, you'll have good luck.
Mr. Fannin.
Find a penny.
Repetitive rhymes, prayers, it's classic. He feels he needs to say it a specific number of times, probably a multiple of 3.
Let's get him in before he decides to start again.
You're removing part of my skull cap? Do you really have to do that?
That's the only way I can get to the affected part of the brain.
And the operating room? It's clean, clean, clean?
Yes, it's clean, clean, clean. I'm gonna go get ready.
Can you stop that, please?
No. Sorry. I wish I could. She's judging me.
No, she's not.
Yes, she is. I've been living with this for 3 years, and it's always the people who are most like me who judge me the most. You're type A, right? Straight A student, top of your class?
Yes, I was.
Well, so you've managed to turn your compulsions into something productive. But we're cut from the same cloth. That's why you can't stand me.
Oh, time to go.
But I'm not done.
Oh, yes, you are, sir.
How many did you have to do?
96.
Let him finish.
Fine. I'll see you in the OR.
Okay, so I hope you enjoy the video and get better understanding what is OCD. So now let's come to the epidemiology in worldwide. Approximately 2.3% of the populations between age 18 to 54 suffers from OCDs, which outranks mental disorders such as schizophrenia, bipolar disorders, or panic disorder. When OCD starts in childhood, it is more common in boys than girls. The usual times of onset is later for females than males, but the disorder is equally common among adult men and women. In general, cross-national epidemiological data on OCD has shown consistent regardless of the diagnostic instruments used. But there may be little cultural or economic influence on OCD prevalence in developed and developing countries. Now let's move on to the prevalence in Malaysia. There is an extrapolation of prevalence and incidence statistics suggests that we have 285,383 OCD patients in Malaysia, which is very, very high. Okay, so now let's move on to the changes from DSM-4 to DSM-5. Okay, so in DSM-4, OCD was belong under anxiety disorder chapter, whereas OCD has its own chapter in DSM-5. On the other hand, the old DSM-4 specifier with poor insight, whereas in DSM-5, it has its own specifier and allowing for some degrees on a spectrum of insight. such as good or fair insight, poor insight, or absent insight. On the other hand, it is only included obsessive-compulsive disorder, body dysmorphic disorder, and trichotillomania, which is hair-pulling disorder in DSM-4, whereas in DSM-5, it included OCD, body dysmorphic disorder, trichotillomania, and added 2 extra disorders such as hoarding disorders and excoriations, which is nail-picking disorders. Now let's move on the menu. Okay, so from the menu you can see there are 5 major obsessive-compulsive related disorders, and I will focus on these 5 disorders only, and the rest you will need to have further reading by your own. So in the menu, we can see there are obsessive-compulsive disorder, body dysmorphic disorder, hoarding disorder, trichotillomania, and excoriations. Now let's move on to the disorder one by one. Okay, so for obsessive-compulsive disorder, the patient or client is aware of the obsessive-compulsive behavior which is unreasonable but will not able to control. The compulsive symptom could be time-consuming, causing the emotions and financial distress which results to social impairments. The most common compulsive behaviors are repeatedly checking, excessive cleaning, arrange and rearrange, and etc. For body dysmorphic disorder, it is the preoccupations with an imaging defect in appearance of disproportionate concerns with a slight physical which cause significant distress or impairment in important areas of functioning. For hoarding disorder, it is a person's irrational, persistent difficulty in discarding or parting with possessions regardless of their actual value, such as newspapers, boxes, tin, and etc. For trichotillomania, which is hair pulling disorder, it is an urge to twist or pull out one's hair. It may involve skull hair, eyelashes, eyebrows, or other hairs on the body. For excoriations, which is skin picking disorder, it involves conscious creations of neurotic excoriations through repetitive scratching. Neurotic excoriations can be initiated by some minor skin pathologies such as insect bite or acne. So you will tend to, when you have an acne or insect bite, you try to pee or scratch it. But it can also be independent out of any pathology. Now let's move on to the main cause of OCD. It is the presence of obsessions or compulsions or both. For obsessions, it is the recurrence and persistent thought, urge, or image experienced during disturbance that cause marked anxiety or distress. The individual attempts to ignore, suppress, or to neutralize them with some other thoughts or actions. For compulsions, it is the repetitive behaviors or mental acts that the individual feels driven to perform in response to the obsessions or rules that must be applied rigidly. These performed behaviors or mental acts are aimed to reduce anxiety or distress, but it is not acting in a realistic way or are clearly excessive. In the DSM-5, obviously we can see the specify, which is with good or fair insight, with poor insight, or with absent insight. It can be also specific if there is any tic-related or past history of tic disorder. So I have a short video about the OCD and you will get better understanding about it.
All right, here's a question for you. What did you do this morning when you woke up? Do you have a routine? You get up, make coffee, take a shower, read the paper, get dressed, head out the door. But some people are imprisoned by rituals. And today my guests say that these simple daily routines that we all do are making their lives a hell. Now, my first guest, Jennifer, says that she has been suffering from obsessive-compulsive disorder, or OCD, for over 20 years. What we want to do today is take an intelligent look at this serious situation and have a conversation about it. Now, take a look at a basic task of cracking an egg.
I'm allowed to have 4 eggs every day, but I only eat the egg whites. So in my head, I usually count my eggs because I want to make sure that I don't eat more than 4. So I see that there's 3 there and 1 in my hand. So I'm good. And I always look at the yolk to make sure that some didn't get in the bowl. And of course, when you know it, the yolk broke. So. Anyways, I'm not going through this whole process. I'm not even having my eggs tonight because I'm not hungry anymore. I'm not doing this. Can you move, please? I'll just maybe cook them a different way. I'll boil them or something. I'm pissed off. I'm pissed off. It's just, it takes too much time to do this because of stupid yolk. I'm just frustrated. I shouldn't be standing here. I should be watching TV or getting ready to go to bed. Or doing something that I want to straighten up. Everything is all over the place. My floors are a mess, and I just feel like everything's a mess.
Well, it sometimes takes Jennifer up to 5 hours just to get out of the house, and that's to just go to the gym. Now, Jennifer takes us inside the world of OCD, starting when she woke up at 3:30 in the afternoon. Take a look.
Right now, it is a little bit after 3:30 in the afternoon. Just getting up now to start my day. Last night was horrible. I only fell asleep about 7 o'clock this morning. I want to get up, tidy around, make my bed, start the laundry, clean the litter box. I'm just lint brushing some of Zoe's favorite spots. I like to do this just to keep the fur off my furniture. Usually on Tuesdays and Thursdays, I give everything in my kitchen, the surface areas, I just wipe them off, clean them down. So I just kind of backtrack in my head. I've done that, I've done that, I've done that, I've done that, okay. Every Thursday, I usually do the lint brushing, but I stand here for a minute and kind of replay it in my head because it doesn't feel like it's done. I just gotta think for a minute to see if I did it.
You really don't know?
No, I know that I did it, but it doesn't feel like I did, and I want to do it again. But if I remember something from doing it, then that's kind of my proof that I did it. I remember doing it because I told you something about Zoe. I do her favorite spots. So that's done. So it's kind of like a check mark in my brain. Okay, that's done. So now I have to fix this tape so that it's at the right spots, that I know that it did tape. There. And I have to say this in this order, my last 4 check marks of the day. I went down to check the mail, there was nothing. I found the spot, it was Chad and Melanie, so days did tape. I have that. This is for my protein drink after. I'm allowed to have that today because it's Thursday, and then I open up the fridge and I see my orange. And that's something that I'm allowed to have today, too.
Who's allowing or not allowing you to have things?
Me? I believe that I have issues with food. I'm gonna start measuring some cereal to eat. So sometimes I just double check on the side of the box, a half a cup, and this says a half a cup. Sometimes I have to stare a little bit because I want to make sure that I'm not making a mistake with the measuring cup. And I see that it says a half a cup and this is a half a cup. So I just make sure that they're all lying flat as much as I can. Oh, this doesn't feel right. I need to start again. Now what I'm gonna do is pour some milk for dinner later. I like to make sure that I have a little bit less than a half a cup. And I usually hold it up at eye's length to make sure, and then I gotta pour some out. But what I do to make sure that it's not above the half is I usually put it on the top shelf in my fridge, and then I just have to stare at it for a few minutes. So I can see that it's a little bit less. Just measure. This weighs 0.8, but I just want to make sure. So I usually just weigh it a couple of times. It says 0.8. 0.8. I usually don't like any of my food to weigh more than 7.6. So I know that this has to weigh 8.4. Some of this is gonna have to go in the garbage. I like it filled right to the top. I'm usually always repeating the number of water glasses I have in my head so that I don't lose track. The last thing I do before I head out is I just recheck my freezer, make sure everything is in order. And I look in here, and I look in the garbage to make sure I see my cashew wrapper, so I know that that's what I ate, and that's the only thing that I had. Right now, I'm just thinking I had a glass before I had my cashew bar, and I had a glass after my cashew bar. So I've had 2 glasses. I took my vitamins, so I'm good to go.
My son Michael has the most debilitating OCD.
Michael! My OCD is not your usual type of OCD, which is hand washing, cleaning 30 times a day. Mine's all what you call sensory OCD.
Come on, body, work!
Everything on my body is all about perfectionism. When something doesn't feel right, what my body says is 3 things. Did I hear it right? Did it seem right? And did it feel right? When I swallow, I gotta make sure it's perfect. If you swallow, there's noises that your body makes. Now, I do it really fast, so it doesn't make any noises. The longest time it took me to do that was 255 different swallows. I don't really blink. My body counts how many times I blink, and I just basically train my body. If I can't blink, I can't blink. So I just kind of like go with that kind of halfway blink. The perfect cough is basically what it is it's 3 times. And they have to be the same pitch. The third one's got to be a high-pitched cough. I started having OCD tendencies when I was 13 years old.
When he was around 13, my husband and I were sleeping, and Michael walks into our room screaming. And I said, Mike, what's wrong? And he says, I can't dress myself. He couldn't put one sock on. He was fine the day before. Hi, is the doctor in?
Pam and I were on the internet 24/7 trying to find help.
We've tried everything. We went to a hypnotist. We did acupuncture.
We've even tried a light treatment. Our latest one was horse therapy. I had some friends say that, Jack, the only thing you could do is have him committed. I said, that ain't gonna happen.
I'm not giving up on this kid. I love him too much. And that's one of the reasons that I called in, because there's no way I was gonna give up on him. I love him. And he loves him just as much, but he can't stand seeing him go through it.
He's not just my son, he's my buddy. We got a good relationship. It's heart-wrenching.
Michael!
You were very animated at the end of that piece, for example. You were yelling, actually screaming, and kind of fighting within yourself. What do you think when you see that?
It feels like there's a pinata in my brain. When you have a pinata and you break it, everything comes out. And after I just saw that, I'm like, Mom, Dad, you had to watch that 24 hours a day, 7 days a week to go through their son that they loved so much, to go through that every single day. And no one knows what the real answer is. My OCD is all different. It's hurt, it's pain, it's guilt. It's like, holy cow.
And it's hard for you guys to watch this, right?
It's very hard, but we live with it 24/7.
Mm-hmm. You say that there are times that you're actually afraid of him. Not that he would want to do something, but you're afraid of him. What is it you're afraid of?
Well, he was on some medication, and it caused him to be very angry, and he became, it was like living with a monster. My son, who is the most giving, loving person anybody could ever meet, had turned into a monster.
Michael says that his OCD does cause him from time to time to go into a trance state. Take a look.
When I was about 9 years old or 10 years old, that's when trances started to hit. When a trance comes on, I can't feel it. They just hit me like lightning. What a trance looks like is my body, I call it out of commission. I can't do anything, and it could take a matter of hours. And the longer it takes, the more scared I get. The longest trance I've been in was 21 hours. When I'm in a trance, I always count in numerical order, but I wait for the odd numbers. I'm aware of everything around me. I can hear everything. I can see everything. My body gets very, very sticky.
When he goes into a trance, he needs dead silence in the house. If I want to talk on the phone, I'd have to sneak outside in my backyard and talk really softly because his hearing is different than everybody else's. One day he was screaming because he heard a leaf drop. I've told everybody, please, just don't call the house. I said, if you call and he's in a trance, he has to start all over.
Trances are very, very hard to be in. It feel right. My brain's like a nice, big, fluffy pillow. When it doesn't get accepted, it feels like someone put a knife in my brain. It feels very sharp. It's very, very painful.
He's had these trances throughout his life, but for the last 9 months, it's the worst I've ever seen. I've got holes in every wall.
I'll get sweaty, I'll cry, I'll hit myself.
Michael!
As a parent, you just want to die, you know, because you feel helpless. You know, nobody has any answers for you.
People and friends have said, well, he's doing it for attention. But we know for a fact it's not attention. There's something in his brain that is triggering this. What is it? It's the million-dollar question. We don't know.